We're getting rid of Obamacare.
We have to repeal it, and we have to replace it with...
Obamacare does not work. It has to go.
Taking a step toward fulfilling their campaign promises, House Republicans released a proposal to repeal and replace the Affordable Care Act, otherwise known as Obamacare. The plan, called the American Health Care Act, would create a new refundable tax credit to replace federal insurance subsidies. It would freeze Medicaid expansion in 2020, defund Planned Parenthood, expand health savings accounts, eliminate fines for Americans who don't buy insurance, and repeal a mandate that requires larger businesses to provide health insurance to their employees.
This bill will go through the committee process, go through the Budget Committee, then go to the floor of Congress under what we call regular order.
While the bill marks the first formal attempt by Republicans to unite their party behind a specific plan, it could launch a messy GOP battle on Capitol Hill, particularly when it comes to the new tax credits.
Republicans are united about repeal, but we're not united about replacement.
Republican leaders in the House say the credits will help Americans buy insurance if they aren't covered by their employers. They would be based on a person's income and age, and the credit would be phased out for individuals who make more than $75,000 a year. The tax credit size would be capped at $14,000. But some fiscally conservative Republicans oppose the tax credits, saying they amount to the creation of another entitlement. In an opinion piece published Monday by Fox News, Senator Rand Paul and Representative Mark Meadows wrote, "Conservatives don't want new taxes, new entitlements, and an Obamacare Light bill. If leadership insists on replacing Obamacare with Obamacare Light, no repeal will pass." Additionally, the proposal to cut hundreds of millions of dollars in federal funding to Planned Parenthood could meet resistance in the Senate.
There is not a consensus. It is very complicated, and we shouldn't rush it. We need to get this right.
One controversial idea House Republicans dropped was imposing a special tax on some employer-provided benefits. They originally considered the provision as a source of funding, but it drew strong opposition from conservatives. And House Republicans are proposing to keep some of the most popular Obamacare rules intact, letting young adults stay on their parents' health insurance until they're 26 years old, and prohibiting insurers from denying coverage or charging more money based on pre-existing conditions. Insurers, however, can impose a 30% price increase on people who go uninsured for more than 2 months. It isn't yet clear how much the American Health Care Act would cost or how many Americans would gain or lose coverage under the changes.